Ask the editors. Virginia and Nicole answer your questions about medical writing. How do I start in medical writing? I found many types and many videos, so I got confused about how to start in medical writing and become a medical writer. Nicole says, getting started in medical writing can feel overwhelming, but don't worry, you've got this. Begin by listing your skills and interests, then explore different writing styles to find your niche. You might fall in love with more than one type of writing, and that's okay. Start a blog, volunteer, do an internship, or connect with mentors to gain practical experience. Talking to medical writers can also provide valuable insights. Leverage LinkedIn and professional medical writing associations for this. Along the way, you'll build a portfolio, hone your skills, and discover what you truly enjoy. Luckily, this first issue of Medical Writer magazine is packed with great tips to help aspiring medical writers get started and find their groove. Virginia says, there are lots of types of medical writing, and you can take a look at what type of medical writing you would be most interested in. If you enjoy clinical trial data and the world of drug discovery, you might like regulatory medical writing. If you enjoy teaching healthcare professionals, you might like creating courses or writing books. For more creative work, you could go into marketing, journalism, medical communications, and medical copywriting. Once you choose which type of medical writing, put together a portfolio and speak to medical writers and recruiters to see what the job market is like. You only need one client. A testimonial will help get you your next client. How do you see the current European job market for medical writers specialized in continuing medical education? Virginia says, this is a great question, and I recommend you speak to recruiters who find medical writers for this type of medical writing. They know the market best. Generally, medical writing is in demand, and it's useful to network with people to increase the chances of them reaching out to you when they need you for work. This means you're less dependent on how well the job market is doing. It's worth keeping up appearances on LinkedIn by posting about your expertise, so you're visible to people who may want to work with you in the future. An online presence is pretty helpful in a competitive market. Hi, I'm a medical writer from India. I want to know if I can work with any international medical writing agency remotely after 2 years of experience. What salary can I expect? Nicole says, yes, you can absolutely work with international medical writing agencies remotely, especially with 2 years of experience. Many agencies and other companies value skilled writers regardless of location. Salaries vary widely depending on the agency, your expertise, and the type of writing. I suggest doing some research to better understand the compensation structures for remote roles. I'm not experienced with it, sorry. To land roles, try networking. LinkedIn is great for this, and tailoring your applications to showcase your skills can help you land suitable opportunities. Good luck and let us know how it goes. Virginia says, I agree with Nicole. You can work for any international agency, but have you considered also finding independent clients? You might find a greater variety of work to help build your skills as a medical writer. For example, I started writing YouTube scripts for a health information channel, and this really helped validate my passion for videos. In terms of salary, you could speak to recruiters for guidance and also fellow medical writers who have found success working as international medical writers. How can a life science PhD or someone with an M.Phil in biochemistry transition into medical writing? Nicole says an M.Phil in biochemistry gives you an excellent foundation for medical writing. You already have a deep understanding of scientific concepts, which is a big plus. A life science PhD is a valuable asset in transitioning to medical writing. It demonstrates your ability to analyze complex data, communicate scientific concepts clearly, and think critically, all essential skills in medical writing. Your expertise gives you credibility and a strong foundation to understanding the science behind the writing. In this first issue of Medical Writer magazine, our authors share plenty of practical tips on taking your first steps into medical writing. Be sure to check them out. Is it, medical writing, a real possibility in English if English is not your first language? What does a typical day in the office look like? Nicole says, absolutely. Many successful medical writers work in English as a second language. Focus on developing strong writing, grammar, and communication skills. There are plenty of free writing and communication courses available online and paid ones through various professional medical writing associations. You can also use tools like Grammarly or seek mentorship to refine your work. Your unique perspective and expertise are assets that far outweigh the fact that English isn't your first language. A typical day in the office very much depends on the type of writing you do and the setting. For example, agency, CRO, which is a contract research organization, or pharma company. Generally, it involves reviewing, writing, and editing documents or communications, collaborating with colleagues or clients, and managing timelines. Chances are you'll also do a fair bit of literature searching and attending meetings. Every day is different, but as long as you enjoy it, rewarding. Virginia says, English does not need to be your first language for you to become a medical writer. In fact, I grew up speaking Arabic, so English is technically my second language. Knowing a language other than English is an asset. You can offer translation services and understand cultural nuances for specific audiences. I've never worked in an office full time. Usually, I attend an office day every few months to be physically present with my colleagues and clients. They will hire an office room for a few days, and it's similar to working from home. For me, I plan, research, write, review, edit, and get feedback from clients or colleagues. Unless there is a deadline coming up fast, it tends to be pretty chill with a few emails and meetings in between. Hi, I just got into the industry and it's overwhelming. Most medical writing positions require 5 or more years of experience. How do you break through that when you're just starting? Where can you find opportunities outside of LinkedIn? Nicole says, congratulations on starting your journey in medical writing. Breaking into the industry can feel overwhelming, but don't worry, many writers have been where you are. While experience requirements may seem daunting, focus on building a strong portfolio through internships, freelance projects, or volunteering for nonprofits. Many organizations value skills and potential as much as experience. Outside of LinkedIn, check out professional associations for medical writers, which often have job boards or networking opportunities. Medical writing focused job sites, company websites, and online forums are also great places to explore. Good luck and let us know how it goes. Virginia says, I'm sorry to hear you feel overwhelmed. Hopefully you will find lots of tips to help you in Medical Writer magazine, especially how to connect with recruiters to bring jobs to you rather than you searching for them. You can also create your own opportunities. Start writing, create a collection of articles, and start posting online to become more visible to people who may want to hire you. For a short time, you may not do the work you want to do, but this will help you build a reputation and skills. I started as a pharmacist with zero writing experience, and it was a learning curve for sure. I started by writing scripts, managing projects, and doing clinical checks and editing. To break through, you could try specializing in a specific therapy area. This helped me land my first job on Upwork, as I specialized in travel health and checked pages for an online doctor at the time. I've used Upwork and Juno to find opportunities and the contact page on the websites of companies or people I want to work with. Give it a try, and in the future, opportunities will come to you as you expand your network and skill set. I recently started working in regulatory medical writing, and I'm curious if anyone uses LaTeX for creating regulatory documents. I used it for my PhD thesis and found it incredibly simple and efficient. No issues with formatting, text alignment, consistency, etc. However, it seems like in the medical writing world, everything is done in Microsoft Word, or maybe there are other programs I haven't heard of but should know about. Nicole says, that's right, Microsoft Word is the standard in regulatory medical writing, mainly due to its compatibility with templates, track changes, and collaboration features. I've also heard good things about Viva Vault for managing and authoring regulatory documents. SharePoint is another useful tool for collaborative authoring, especially during document reviews. I don't have experience with LaTeX and I have limited experience with regulatory medical writing, but perhaps one of our readers can share some insights. Please reach out to us at hello@medicalwritermagazine.com if you do. I'm a GP keen on starting a medical writing career in the near future. However, I'm not sure how to make that leap. I don't feel confident going freelance initially, but the thought of a fast-paced environment of a medcoms agency and extremely tight deadlines terrifies me slightly. I also can't find part-time opportunities with companies, so I wondered if this was rarely offered. It would be great to have an insight into how other people may have made that leap. Thank you. Nicole says, transitioning from a GP to medical writing is a great move. Your clinical knowledge is a big advantage. To make the transition a bit easier, start small. Volunteer, blog, or take on small projects to build your confidence. Medcoms can indeed be fast-paced, so consider exploring other options and other types of writing. Regulatory writing often has steadier timelines. Also, you're in luck. Dr. Matthew Lee is a GP who took the leap into medical writing and shares his experience in his article on page 59. Virginia says, as GP, you've got a wonderful set of skills that are easily transferable to medical writing. Your superpower is your ability to fact-check medical or health information, and that's how I started. As a pharmacist for many years, moving into a career where I no longer see patients face-to-face did take a bit of adjustment. I recommend reaching out to charities or non-governmental organizations that produce health information to ease yourself into medical writing. You do not need to work at an agency, and it might be a bit of a challenge to get into one if you have zero experience. You could try being a project manager or editor. I did this too. Check out Write Clinic for medical writing courses made specifically for healthcare professionals and scientists who want to get into medical writing. You will get feedback on everything from your writing, portfolio, website, LinkedIn, and CV. You can network with over 10,000 medical writers in the LinkedIn group Medical Writing for Beginners and beyond. Searching articles to generate credible information can be quite exhausting. Any tips? Nicole says, definitely. Searching for credible information is so essential given the amount of misinformation out there these days. A structured approach can help. Start by using trusted sources like peer-reviewed journals, medical databases such as PubMed, government or public health resources such as NIH, EMA, or FDA, research repositories such as clinicaltrials.gov, and global health organizations such as the WHO or World Health Organization. If you're referencing online content like blogs, watch out for these red flags. 1. Anonymous posts with no information about the author's credentials or expertise. 2. A lack of links to credible sources, peer-reviewed studies, or official data. 3. Poor web design with excessive pop-ups. 4. Over-sensationalized or clickbait titles. 5. Biased or one-sided perspectives. 6. Aggressive monetization. 7. An over-reliance on testimonials instead of evidence-based information, i.e., claims that seem too good to be true. Always cross-check facts with trusted sources and make sure cited references are credible. Anyone have any other tips to share? We'd love to publish a more in-depth piece on this topic in our next issue. Reach out via medicalwritermagazine.com. Virginia says, I recommend you have a look at who wrote and who reviewed the article and the date it was written, plus the future date it is due to be reviewed in case updates need to be made. Any articles that have no date are immediately suspicious. Sometimes, if you can't find an article with the information you need, it's worth trying to find a person to interview for more information. Some organizations have something called an evidence hierarchy, where they list sources they go to for credible information. For example, their top source could be the WHO, or it could be their National Health Service. It's worth creating your own evidence hierarchy and being transparent about these with clients. You could try Cochrane or the TRIP database and look for a trust mark such as the PIF tick on articles in the UK. As Nicole said, check for any conflicts of interest. Importantly, find out if the article is relevant to your audience. Sometimes an article published in a different country might not be helpful. For example, US guidelines for vaccines do not apply to a UK population. Do be transparent about the quality of the information you have found. Context is key, so use your judgment.